In this section, we are going to discuss the first class in antihypertensives, that is diuretics. Diuretics are also called as water pills. These are the drugs which increase the urine output and decrease the level of sodium and water in the body. It is the first-line treatment amongst antihypertensives and economic for patients as well. There are various types of diuretics that work on different sites of nephron. These are thiazide diuretics or low-ceiling diuretics, loop or high-ceiling diuretics, potassium-sparing diuretics. The thiazides are the most widely used diuretics. They are sulfonamide derivatives. All thiazides affect the distal convoluted tubule, and all have equal maximum diuretic effects, differing only in potency. Thiazides are sometimes called low-ceiling diuretics because increasing the dose above normal therapeutic doses does not promote further diuretic response. If we look into the mechanism of action, thiazides decreases sodium reabsorption by inhibiting sodium chloride cotransporter. It lowers the blood pressure by increasing sodium and water expression. This decreases extracellular volume, resulting in lower cardiac output and renal blood flow. With long-term use, peripheral resistance decreases. Thiazides are useful in combination therapy with a variety of other antihypertensive agents, including beta blockers, ACE inhibitors, ARBs, and potassium-sparing diuretics. Common examples are hydrochlorothiazide and chlorothalidone. If we discuss loop diuretics, they inhibit the co-transport of sodium-potassium and chloride pump in the loop of Henle. It decreases renal vascular resistance and renal blood flow. Loop diuretics are the most effective drugs. These drugs have a very rapid onset and fairly short duration of action. Examples include furosemide, umetanide, and torsemide. Potassium-sparing diuretics act to prevent sodium reabsorption in the collecting tubule by either binding epithelial sodium channel or by inhibiting aldosterone receptors. This prevents excessive excretion of potassium in urine and decreased retention of water, preventing hypokalemia. Amiloride and triamterene block sodium transport channels, resulting in a decrease in sodium-potassium exchange. Inhibit sodium reabsorption in collecting duct, which means sodium is excreted out of the body. Spironolactone and eplerenone are aldosterone receptor antagonists. It will inhibit the aldosterone receptor, thus prevent sodium and water absorption in the body. Spironolactone is useful in patients with congestive heart failure.